Dr. Marty, we've spoken a lot about Omicron and the virulence. What we're seeing, though, now is the hospitalization rate is not as high as the case rate. So how do you account for that?
Yeah, so there is data that suggests that it is milder, but more significantly is a lot of the cases are reinfections or people who have vaccine and some who have boosters, and those make up a very small percentage of the people we're seeing in hospital. But if you look at what's going on right now, even if the percent that's going in isn't that high, there's still, the numbers of people in our hospitals, we're overwhelmed again. We're already asking for help. It's not a pretty situation in our hospitals.
I guess when you're talking about the virulence, even if it is a crazy number of cases and then maybe a much smaller number of hospitalization, the crazy number of cases is going to mean enough of a rise in hospitalizations to, as you said, overwhelm hospitals.
Yeah, and that's what we're seeing already. It's already a problem. And let's not forget that we're also seeing a higher caseload in children than we were, in part because so many children are the ones that are unvaccinated. So it really is incredibly important that we get as many people vaccinated and boosted as possible. They're not wrong in Israel to consider another shot.
Let's talk about students. You were just talking about kids getting this more because a lot of kids aren't vaccinated. I want to play one soundbite from the Florida Surgeon General, Joseph Ladapo, announcing a new testing priority or lack of priority for your state. Let's listen.
If your grandmother gets a test, that's a much more valuable test than the 8-year-old, third graders that Los Angeles County is sending in to get weekly testing, right? We're going to be working to unwind the sort of testing psychology that our federal leadership has managed to, unfortunately, get most of the country in over the last 2 years.
So he's saying the testing of your grandmother is just frankly a little bit more important right now than the testing of your 8-year-old. There are people out there that are scratching their heads at it. Some are getting angry about it. But is there some sense to that?
No, there isn't any sense to it because it's that 8-year-old that gives the hug to the grandmother that causes the problem that the grandmother ends up in the hospital with. That's the bottom line. And there's the secondary issue that the more it spreads, the more mutations you have, and the more chance there is that the next variant will not only be able to overcome our monoclonal antibodies, but as this one already is, and also be more virulent. So you don't want this to just spread wildly among children. Not to mention the fact that, unfortunately, a very significant number of children have gotten ill enough to require hospital care. So
what does a very significant number of children mean? What is that number?
So it's hard to get a handle on the exact numbers because the best data is coming out of the American Pediatric Association, and they have noted more than 700 children that have died of COVID-19 in the United States. Those numbers are even larger worldwide. And then there are children that are still suffering long COVID symptoms, a smaller number that have had the Kawasaki-like multisystem inflammatory syndrome, which is also a big problem in kids among those who get it, fortunately a small percentage. And then our hospitals, our children's hospitals they certainly were during the Delta phase overwhelmed with children cases, and now we're seeing an upward tick in it. But what we're seeing and what we're doing a lot is a lot of the cases that we used to hospitalize, we're managing as outpatients because we have better techniques to do that.
I just want to be really clear when we're talking about kids, because parents are obviously terrified for their children, given what we're talking about. But when we talk about the kids who have died from COVID or the ones who've had really negative outcomes from COVID, and this, I understand every parent is concerned, but are we talking about otherwise healthy kids, or are we talking about kids who have pre-existing conditions?
So most of the children that have ended up in the hospital were previously totally healthy kids. However, those children who wind up in the ICU and stay there for a long time are children with underlying conditions. So you have both.
All right, Dr. Marty, thank you so much. Allison Barber, thank you as well.